Hello and welcome back to Unacademy. So let's get NEET PG. Myself, Dr.Muskan Chaudhary, and today we'll study about the images of the parasitology that are left on that due to some network error. Alright, Unacademy is India's largest learning platform where you can access both the live and the recorded sessions that to learning from the India's topmost educator anywhere and everywhere. Compete in the live T&Ds and study on the device. Access up to 25,000 of the MCQs and printed and digital notes that are being provided by the Unacademy. Iconic subscriptions is something that is of a great advantage for the students because PrepLadder has come together with the Unacademy, and PrepLadder is very famous for its rapid revision and the snapshots and the treasure and the 2021 dream notes with the well-structured live batches and the recorded classes and up to 25,000 of the MCQs, and you can compete in the live T&Ds with comprehensive and the digital notes. Now for the 24-month subscriptions you get around 50 100. It is will cost you around 1500 per month, and for 24 months of icon subscriptions it will cost you around just 22,438 rupees per month. All right, raise a hand is a feature that Unacademy has provided, and you can personalize. You can personalize your this interactive session with the Unacademy educators by raising your hand and one-on-one discussions with the doubt-solving sessions and examination day. Every month, the Unacademy conducts about exam day so that you can analyze and help yourself and look where you stand in the competition. Just giving the exam, and this time it is on the 23rd of the this was on the 23rd of the October at around 2 to 4 p.m. Highly effective QBanks of 25,000 MCQs, and that was too based on the latest examination pattern. And please do use my code, that is Muskan 10 to get 10% of the discount. All right. Now, special class features, it includes interactive live sessions. You can do the polling for the learners, raise a hand features, and never miss a class because you will get a notification. You will get a notification for the class, and then download the lecture notes on the Unacademy anywhere and everywhere. You can attend the sessions, be it you are traveling, be it you get a time in during your OPD sessions, so it will just help yourself and watch the videos. All right, now we'll come to the about the perks of the Unacademy. With 24-month subscriptions you get 4 months subscription totally free, and with 12 month subscriptions you get 2 month subscriptions totally free, and use my code, that is Muskan 10 to get 10% of the discount, to get 10% of the discount. All right, so we'll come to the first image of the today's session. The first image of today's session is what it is actually a quadrinucleate cyst. What is it? It is a quadrinucleate cyst, and we are talking about which protozoa. We are talking about ant amoeba. We are talking about ant amoeba histolytica. We are talking about ant amoeba histolytica. ठीक है, and it is what a quadrinucleus cyst, that is what infective and the diagnostic form, infective and the diagnostic form of ant amoeba histolytica is what quadrinucleus cyst, and it is the only pathogenic species amongst the ant amoeba, because ant amoeba, apart from the ant amoeba histolytica, we also have ant amoeba disper and ant amoeba hartemani. Okay, so it is the most pathogenic species. And what is the habitat? What is the habitat? The habitat is what? Cecum more than the second habitat is what? Sigmoid colon. So most common habitat is what? Cecum, and mode of infection is what? Fecal-oral route is what? Fecal-oral route is the mode of the infection, and infective form is what? Quadrinucleate cyst is what? Quadrinucleate cyst is what? Quadrinucleate cyst is what? The infective form. All right, just a second. हेलो. हाँ, इमरजेंसी में हो ना, तो वो पेशेंट पहुंच गया. हाँ. हाँ, क्योंकि ना पहले से डॉक्टर को वैसे कह दिया था, जो अभी नाइट ड्यूटी पे है ना, तो वो अपना काम कर रहे हैं, उनको एक बार देख लेने दो, है ना. बाकी वो मैंने बात कर ली थी, तो अभी वो तो ना ऑपरेशन थिएटर में है, तो अभी तो फोन उठाएगा नहीं। वो जो डॉक्टर है ना, वो डॉक्टर सुरेश, वो है नाइट ड्यूटी पर, वही देखेंगे। तो वहां पे जो डॉक्टर है ना, वो वही है, उन्हीं को ही कहा था। हाँ हाँ। ठीक है, तो उनको सब बता दिया है, उन्होंने कहा था कि मैं देख लूंगा, तो एक बार उनको काम करने दो। सीरियस कंडीशन है तो ऑर्थो सर्जरी और न्यूरो सर्जरी तीनों अपने आप रेफरेंस में लेंगे वो, है ना? ठीक है मामा जी। सॉरी फॉर दिस, दिस वाज अनअवॉइडेबल। कोई रिलेटिव हैं जो इज एक्चुअली इन सीरियस कंडीशन एंड आई हैड टू अटेंड द कॉल। सो वेयर वर वी एंड that is a where were the three forms that are present are what? Trophozoite, cyst, and the quadrinucleocyst are the three forms that are present where in the ant amoeba histolyticus. And excistations, where does the excistation takes place? The excistation takes place where? In the small intestine, where it will be converted into what? Eight, where it will be converted into a trophozoite form, then it is binuclear cyst, and then finally in the quadrinuclear cyst, and the quadrinuclear cyst is released along with the stools, and it is the infective and the diagnostic form. All right. Also one more thing is that ki the trapezoid form, it does have what? Pseudopods, and it engulfs what? RBCs. Okay, it engulfs the RBCs in the food vacuoles, and this is what? Erythrophagocytosis. And this RBC is not present. No RBC in the food vacuoles is present in what? In and amoeba disper. And amoeba disper doesn't have the RBCs in the food vacuoles. All right. Now, talking about the clinical symptoms, talking about the disease, it is mostly asymptomatic condition, asymptomatic. But other than this, it is what causing the intestinal amoebiasis. It is causing what? Intestinal amoebiasis and extraintestinal amoebiasis. Okay, so intestinal amoebiasis, it is causing what? Flask shaped ulcer in the small intestine. It is causing what? The flask shaped ulcer. In the extraintestinal amoebiasis, it is causing what? The encove. It is mainly involving what part of the liver? It is the posterior superior part of the superior surface of the right lobe, and causing what? The causing the necrosis of the liver and releasing what? The pus and the abscess formation similar to that of the sauce, that is anchovy sauce pus. Okay, anchovy sauce pus causing the liqueficative necrosis of the liver, releasing what? The anchovy sauce pus. Now, most those people who have diet rich in the cholesterol, those people who are of low socio-economic status are more at the risk of developing what? The Entamoeba histolytica clinical features. All right, for the diagnosis, we take around 3 to 5 stools, and we check for the trophozoite and the quadrinuclear cyst. Both are present, and serology doesn't have role in the amoebic dysentery. And these are the flask shaped ulcer. All right, please remember the flask shaped ulcer. And for the culture, we either use the Craigie's media or the Robinson's media, all right, or the Diamonds media or the Boyx media. So these are some of the medias that we use. And amoeba hartmanni is also known as, although it has same morphology as ant amoeba histolytica. ठीक है, and it is also known as small race amoeba. Okay? It is also known as small race amoeba. And what is the drug of the choice for the antamoeba histolytica? It is what? Metronidazole. It is what? Metronidazole is what the drug of the choice. Now, this is what? This is again, this is the anchovy sauce pus. This is the anchovy sauce pus, and it is causing the little liquefied necrosis of the liver and releasing the pus that is similar to that of the sauce, that is anchovy sauce pus with the causing in the posterior superior surface of the liver. It is the anchovy sauce pus. That is what anchovy sauce pus. Now, this is the brown color that is compared with to the anchovy sauce pus. Now, this is what this is. This is the charcoal laden crystals. These are what the charcoal laden crystals, and they are found in the Anatomia histolytica. They are both found in the stool as well as the chaos preparation of the sputum, that is the charcoal laden crystals. Although they are present in the Anatomia histolytica, but they are not very characteristic because apart from the Anatomia histolytica, they are also found in other disease as well. Now, we'll talk about some free living amoeba. We'll talk about the free living amoeba. Okay, we'll talk about the free living amoeba, that is first we'll talk about what are the free living amoebas. One is what Nagleri fowleri, and another is what acanth amoeba, and balamuthia. Okay, so Naglari fowleri, acanth amoeba, and the balamuthia. Now, brain eating amoeba is what is we are talking about the Naglari. We are talking about the Naglari fowleri, and what is the habitat? What is the habitat? It is water and soil. It is water and soil is the habitat. And what is the host? What is the host? Man is an accidental host. Man is an accidental host. Okay? Man is accidental host. Okay? Man is what? Man is the accidental host or the dead end host or the dead end host. Okay? So man is what? Man is the accidental host or the dead end host. And what is the mode of infection? The mode of infection is like person is taking bath in the swimming and taking the swimming, doing the swimming in the water, and the trophozoite form of the this brain eating amoeba that is to the nasal cavity reaches up to the cribriform plate, and to the cribriform plate it goes up to the this meninges to the olfactory nerve. So this is the mode of infection of the Naglieri fowleri. So this is the mode of infection, and it causes what? Primary amoebic meningo encephalitis, and this is seen in the immunocompetent person, seen where? In the immunocompetent person. And it is reported from where? It is reported from the temperate areas. Person dies within 3 to 6 days of the infection. It is highly fatal condition. It is highly fatal condition. And it is what? Highly fatal condition. What is the most sensitive examination? The most sensitive is PCR. And for the treatment, we doesn't till know the treatment. The treatment is not known till now. The treatment is not known till now. All right. So we'll talk about this is what the necrosis of the brain tissue by the Naglari fowleri, and it is causing what? The primary meningoencephalitis. Acanthamoeba, it is what? It is caused the granulomatous amoebic encephalitis and the chronic amoebic keratitis, and the Balamuthia is also causing the meningoencephalitis. Alright, pathogenesis, it causes a diffuse meningoencephalitis with the hemorrhage and necrosis of the brain. Patient presents with fever, headache, vomiting, and disturbance in the sense of the smell and the taste. And the coma and the death within 3 to 6 days of the infection. And it is highly fatal condition. It is what? Highly fatal condition. Now, next we'll talk about what is this? What is this? Please identify that. What is this? Identify. What is this? Please identify this. This is what? This is the trophozoite form. This is the trophozoite form of what? Of Giardia lamblia. Of what? Giardia lamblia. And what is the infective form here as well? It is what? Quadrinucleocyst, and it is what? It is an direct parasite. It is what? It is an direct parasite similar to the Amoeba histolytica and Trichomonas vaginalis. All right, and the cyst of Giardia can survive the chlorination of water, can survive the chlorination of water, and it lacks what? It lacks the mitochondria. It is the only pathogen. It is the only pathogen that is lacking what? The mitochondria. All right, and it is only protozoa. It is only protozoa that is found in the lumen of the small intestine, that is found in the lumen of the small intestine, that is found in the lumen of the small intestine. And people with IgA deficiency, people with IgA deficiency are more prone to develop what? Giardiasis. To develop what? Giardiasis. All right. So trophozoite form, it is what? In direct the trophozoite form. This is a trophozoite form Giardia lamblia. It is direct parasite, and the cyst is causing what? The cyst can survive the chlorination of the water. It lacks the mitochondria. It is the only protozoa that is found in the small intestine, and people with IgA deficiency are more prone to develop giardiasis, the giardiasis. All right. Now, when we talk about the trophozoite form is what? Spoon shaped. And what is this? It is also flask shaped. So, it is what? Spoon shaped and the flask shaped. All right. And what is the motility? What is the motility of the trophozoite that we need to remember? It is what? Falling leaf like motility. Falling leaf like motility. Okay. So it is having what? It is having what? Falling leaf like motility. That is having what? Falling leaf like motility. Now, when we talk about the disease, most of the cases, up to 50% of the cases are what? Asymptomatic. Asymptomatic. Please excuse me for a second. हेलो हेलो यार वो उस पेशेंट को देख के आना ना यार फटाफट तो कोई डॉक्टर्स जो बोल रहे थे डॉक्टर सुरेश ऐसा तो है नहीं। और एक बार ना पेशेंट ज़्यादा सीरियस है और मामा जी भी पहुँचे हुए हैं तो एक बार पेशेंट को जस्ट फॉर हाँ उन्होंने पूछा बट देयर वाज नो वन। लिसन आई एम टेकिंग सेशन आई एम सेंडिंग यू द नंबर है ना और टॉक टू हिम। यस आई एम सेंडिंग यू द नंबर एंड टॉक टू हिम। ऑलराइट। Please excuse me for this. This what, but this was an like grave emergency for me. All right. So most 50% of the cases are what asymptomatic, and the patient will present with hypoglobinemia. And what does happen that the trophozoite form they actually with the sucking disc they actually cause the destruction of villi. They cause the destruction of the villi causing what protein losing entropathy, causing the malabsorption, causing the protein losing entropathy. Okay, see that is they causes what the malabsorption, and causing what? Causing the fatty stools or the steatoria on the weight loss or the flatulence. Okay, and this is what we can see. This is a falling leaf like motility, and the diagnosis is by the stool, the repeated sampling to check for the trophozoite form, and the diagnosis other we do the string test or the entero test, that is the gelatin capsule, and we check for the trophozoite. That is what. With the help of what the string. Now, giardiasis is the leading to malabsorption, luminal space of the small intestine showing what the pear shape or the shape or the spoon shape or the flask shape or the pear shape or the sickle shape of the trophozoite form, that is having what? Having the falling leaf like motility. Having what? Falling leaf like motility. Having what? Falling leaf like motility, and metronidazole is the drug of the choice. And metronidazole is the drug of the choice. Okay, so this is what falling leaf like motility having the pear shape or the sickle shape. Now this is the string test I was talking about. The one end of the string is attached to the cheek and the gelatin capsule is ingested by the person, and we take out the sample and we check for the trophozoite form in the this aspirate that we take out with the entro test. Now it is a method to obtain the duodenal specimen, and a coil thread inside the gelatin capsule is swallowed by the patient. After 2 hours, it is withdrawn and placed in the saline and mechanical shaken. The centrifuged deposit of the saline is examined forward for the trophozoite form for the and amoeba. This for the Giardia lamblia. All right. Now, GRDs is especially in the children, and it is duodenum upper part of the small intestine, only pathogen that is found in the lumen of the small intestine, and the trophozoite is attached to the mucosa, causing the destruction of the villi, causing the protein losing entropathy, and contaminated food and the water is the mode of the infection. Apart from this, it is the fecal-oral route infection is also possible, and the flies and the head, these handlers, causing the hetero infection. Now, Please, this image is also important. This is the, although you can confuse it with the giardia lamilia, but giardia lamilia has the exostyle. And if you see this undulated membrane is present here. It is present in what? Trichomonas vaginalis. Trichomonas vaginalis. Okay, Trichomonas vaginalis. It is only protozoa. Is only protozoa with one stage. Okay, it is the only protozoa with one stage in the life cycle. It is the only protozoa with one stage in the life cycle, and that is what? Trophozoite form. That is what? Trophozoite form. All right, and when we talk about it, it is also direct parasite. It is also direct parasite, just like we have talked about the giardia lamblia, just about we have talked about the ant amoeba histolytica, and it is the only protozoa that is having one stage, that is the trophozoite form. And what is the habitat? What is the habitat? Habitat is what? Anterior urethra of the male, or anterior urethra of the female, or it is the cervix or vagina, or the Bartholin glands. Okay? Or the Bartholin glands. So these are the, or the Bartholin glands. That is, it is what? Anterior urethra of the male or the female, or the cervix or the vagina, or the Bartholin glands. So it is what? It is the habitat. It is the habitat for the Trichomonas vaginalis. It is the habitat for the Trichomonas vaginalis, and the host, it is the strict, it is the strict human, it is the strict human pathogen. It is strictly a human pathogen. It is strictly an human pathogen. And what is the infective form? It is the infective form is what? Only form that is present is the trophozoite form. So it is the only form that is present is the trophozoite form. So automatically it is the infective form. And what is the motility? That is the jerky or the twitching, jerky or the twitching, or the rotatory motility, or the rotatory motility. Okay, so they are having the jerky twitching or the rotatory motility, and it is mainly due to the undulated membrane that is attached, or it along with the four anterior flagella, one undulated membrane is attached, which is responsible for the jerky or the twitchy or the rotatory motility. All right. When we talk about the disease, it is causing what? Although up to 50% cases are what? Asymptomatic, but the patient will present with foul smelling, frothy, vaginal discharge, okay? Vaginal discharge with irritation during micturition, irritation during micturition. All right. So the patient will complain of the foul smelling discharge, frothy discharge with irritation during micturition, and very important, that is what? Strawberry. That is what? Strawberry cervix or the strawberry vagina. Okay, and the test that we do for the 10% QH mount to look out for the clue cells is what? We do the Vif test. So this is the trophozoite form with the undulated membrane and the four anterior flagella. These are four anterior flagella, and the undulated membrane for the Trichomonas vaginalis. Tricho. So it is actually, I'm recording session 11 around 11:20, and it is a meeting time for all the society dogs. So they are communicating and talking with each other right now. So Trichomonas T40 is what? Having what? The twitching or the rotatory motility, or the jerky motility. Okay. Now, these are the strawberry spots. These are what? The strawberry spots. Okay. So this is what? Strawberry vagina. and the strawberry cervix, that we need to remember, the other strawberries in the medicine are the strawberry tongue, that is in the Kawasaki disease, strawberry vagina in the trichomonas, strawberry gums is again important, G4G, that is the vagnus, strawberry skull in the adult, strawberry gallbladder in the cholestrosis, strawberry hemangioma, again important, capillary hemangioma, strawberry skin in the sarcoidosis, and the strawberry nasal mass in the rhinosporidiosis. Okay? Amongst these, the strawberry tongue is important, strawberry vagina, strawberry cervix, strawberry gums, strawberry gallbladder, strawberry nasal mass, that is the rhinosporidiosis. Alright, so what is this? This is, as I told, we do the Vif test. We do the Vif test under 10% of the KOH count. I guess it is a little bit disturbing for right now because but all I've already closed the gate. I've closed the gate and it's still so much barking is taking place in the society right now. Okay, so it's a Vif test we do under 10% KOH mount and we look out for what? Clue cells. We look out for the clue cells. Now, these are what? These are the clue cells. Clue cells are nothing. It is the collection of the trichomonas vaginalis. It is the collection of what? The pathogens around the epithelial cells of the vagina. That is the clue cells. That is the clue cells. Right? So, this is the normal epithelial cell. This is a normal epithelial cell, and these are what the clue cells. These are what the clue cells. That is, we can see these are what the clue cells. Okay, that is the collection of the pathogen around the epithelial cell. These are what the clue cells. All right. So, what is the treatment? What is the treatment? And what is the treatment? The treatment is what metronidazole for the trichomonas vaginalis. What is the treatment? The treatment is what for the trichomonas vaginalis is what metronidazole. Okay, so I'll end the session here because I don't think the meeting of the dogs will end for today. I'll end the session here and we'll continue the rest of the image in the next session. So thank you for today's session. Do like, share, and subscribe, and do follow me on the Unacademy channel, on the Unacademy YouTube channel, as well as the app, and on the Telegram. And please do use my code that is was Muskan 10 to get 10% of the discount. To get 10% of the discount, please do use my code that is Muskan 10. Muskan 10 to get 10% of the discount on the NEET PG subscriptions or any other competitive exam. Please do use my code that is Muskan 10. Alright, so I'll see you in the next session. Until that, take care and bye bye.